Ethical courage. This is the fifth principle in the voice framework, and it begins when a nurse recognizes that staying silent may be easier, but speaking is necessary. Imagine a nurse receives an alert from a new decision support tool. The recommendation does not fit the patient's condition. The nurse reviews the chart, reassesses the patient, and believes following the alert could create harm. But the technology has already been approved. Leaders expect staff to use it, and other clinicians may assume the recommendation is correct because it came from the system. The nurse now faces a difficult choice. The nurse could ignore the concern and follow the recommendation, or the nurse could pause, document the clinical findings, and report the risk. That moment is where ethical courage begins. Ethical courage does not remove emotion. Concern is appropriate when a nurse sees risk. The difference is what guides the response. Reactivity is driven by emotion. Ethical courage is guided by evidence, professionalism, and patient safety. A nurse can be firm without being hostile. That is advocacy with courage. Ethical courage means speaking truthfully and professionally when silence could alarm harm to continue. It combines integrity, evidence, humility, emotional intelligence, and respect. In this example, the nurse reassesses the patient, documents the concern, pauses the unsafe action, and escalates through appropriate clinical and governance pathway. The goal is not to reject technology, it is to protect the patient and preserve professional judgment. And if the concern is dismissed, the nurse does not become hostile or simply give up. The nurse strengthens the evidence, involves the appropriate clinical or safety leaders, and continues through the next responsible pathway. Persistence is part of courage. So when silence feels easier, ask who may be harmed, what evidence supports the concern, what needs to be said, how can it be communicated clearly and respectfully, and what action protects safety, trust, and integrity. Ethical courage is not speaking the loudest. It is speaking responsibly when the risk is real and silence would be easier. Observation reveals the concern. Clinical judgment explains the risk. Ethical courage moves the nurse to act. That is ethical courage.